When a senior gets discharged from the hospital, the risk for rehospitalization is massive. At Spring Hills Home Care, we try to mediate the symptoms of transfer trauma by providing a transitional risk management program called the 72-hour program. So what we do is we provide the first 72 hours at their home, round-the-clock care. That allows for our caregivers to track hour by hour what's going on with the patient to see what help they need in the short term as well as the long term. Transfer trauma is a massive issue because it's going to magnify the rate at which a senior is going to decline. When it comes to transfer trauma, the impact on the senior is not only from a physical standpoint, it's also from a mental standpoint. 21% of folks coming home from a skilled nursing facility get rehospitalized. If you implement home care in general, that number goes down to 17%, but the numbers really don't see a drastic change until you do something like implementing our 72-hour program, which our rehospitalization rate is 2%. We recommend our 72-hour program because yes, it's going to be a cost that you're going to pay on the front end, but on the back end, you're going to have much better outcomes with your loved one because you leave nothing up to chance. When the senior is coming back from the hospital, they're usually coming back with orders for therapy, but due to schedules and everything like that, it takes a couple days at times to set up therapy. So what happens is the senior is going to remain bedridden for the initial couple days until they get therapy in place. And we know that 3 days of being in bed attributes to 3 weeks of muscle loss. That's the magnitude of the situation and how much just being in bed for a couple days can affect the senior. So by implementing our exercise physiology assessment, we're getting in there and getting the senior active the first day that they're home. And then if we need to, we can implement a couple exercise physiology sessions to make sure that they're continuing that therapy that they were getting at the hospital to bridge the gap between the time that they get home to when they can actually get on therapy services and continue their rehab.